I'm going to give you a very broad overview about vitamin D, and hopefully I'll convince you that this is a delightful story for good health. Now, I've been talking about vitamin D for a long time, and I'm not sure what he's thinking about. I know he has his own problems coming up this weekend, but what can I tell you about vitamin D that you don't already know about? And I decided I really needed to go to a higher authority. And I went to a physician that I think you all know and recognize for his expertise and how thoughtful and kind he is in making recommendations. And I got him to give you just one comment.
You're an idiot.
That's what he told me, right? And indeed, what am I going to tell you about vitamin D that you don't already know about from the Institute of Medicine report? And so the Institute of Medicine did come out with new recommendations in 2010. And what's remarkable is that they now recommend that the recommended daily allowance for vitamin D is not 200 units of vitamin D a day, but 600 units of vitamin D a day for most children and adults. And also they recognize that the upper limit should not be 2,000 units a day, but they realize that vitamin D is not as toxic as we've all been taught, and that up to 4,000 units a day is perfectly safe. And so I'm constantly interviewed by the press, and I'm asked about the controversy about vitamin D. And I point out to them, I have only one word for you: wow. If you think about it, there's never been a nutrient that has been tripled overnight. But the real question is, did they get it right? And the answer is, in 2011, the Endocrine Practice Guidelines Committee came out with its recommendations. And I chaired that committee, and all of the members are experts in the field of vitamin D. And our objective was clear: to evaluate, treat, and prevent vitamin D deficiency for the care of patients. Right? The Institute of Medicine's guidelines was recommended not for patient care. It was up to professional associations to make these recommendations, and they used a population model, not a medical model. So it's not a surprise that the Endocrine Society would come out with different recommendations. Infants, 400 to 1,000 international units a day. Children, 600 to 1,000 units a day. Adults, 1,500 to 2,000 units a day. And if you're obese, you need 2 to 3 times more vitamin D to satisfy that requirement. Now, this slide says it all, right? We were born, we evolved in sunlight, and we've always appreciated the beneficial effects of the sun. No question about it. People worry about who supports you and conflict of interest, so I get support from the National Institutes of Health, and I consult for a variety of companies. But much to the dismay of the dermatology community, I get support from the sun. And for those that are interested, you can go to this website, drholick.com, for more information about vitamin D. Now, I have been talking about vitamin D, as you've heard from Stefan, for more than 40 years. People could not think of a more boring subject than vitamin D. Found in cod liver oil, prevents rickets in children. We don't see rickets commonly. We're not thinking about vitamin D deficiency. So what is she thinking about? Well, you should be thinking about who is at risk for vitamin D deficiency, and I'll hopefully convince you that everyone is. Indeed, he's worried about global warming. It's very famous Austrian, right? No. What is the big deal about vitamin D deficiency? Because really, rickets is the tip of the iceberg, and osteomalacia, a painful bone disease that physicians have forgotten about, diabetes, multiple sclerosis, rheumatoid arthritis, infectious diseases, hypertension, heart disease, even common cancers have all been associated with vitamin D deficiency. Indeed, in the United States, it was heavily publicized. Discover magazine, of the 100 major medical breakthroughs, number 8 came in, Can Vitamin D Save Your Life? Time magazine the same year, 10 biggest medical breakthroughs, more vitamin D. Now, we're all taught, of course, to publish in the major medical journals. No. Fitness magazine is a super vitamin. And if you want to get your teenagers' attention, there's only one place to publish. Teen Vogue is a sunny vitamin D. But as I had mentioned to you before, it wasn't the doctors getting this information. It was articles like this being published that the patient would go to the doctor and ask to get the blood level of 25-hydroxyvitamin D. And of course, the doctor refuses, but the patient persists. And now the doctor's got religion because the patient is now all of a sudden had the blood level drawn and found to be deficient. And so, like I said, the assay for 25-hydroxyvitamin D is the most ordered assay by doctors in the United States. 1 in 9 Australians now have a blood level drawn. I hope to convince you by the end of this that the Institute of Medicine and the Endocrine Society, we do not recommend screening for 25-hydroxyvitamin D, but rather what we recommend is improving everybody's vitamin D status by encouraging vitamin D supplementation and also some sensible sun exposure, which I'll be talking about. So vitamin D is a sunshine vitamin. Whether you're an amphibian, reptile, avian species, lower primate, always have depended on sun. So what about these dark-haired Neanderthals that lived up in Europe? Well, it turns out their gene has now shown that they were red-headed Celtic. The driver in evolution is clear for why pigmentation devolved. Here's the pelvis of a normal female. This is the pelvis of a female that likely had infantile rickets. She would have had a difficult, if not impossible, time with childbirthing. And so within a few generations, pigmentation devolved. Now, it turns out that we showed many years ago in Boston you can't make any vitamin D in the wintertime in Boston. So I took my daughter on safari. I thought we'd make some vitamin D, write it off on our taxes as a medical expense. Doesn't work. But I tell you what, the Samburu warrior, he's perfectly designed for his environment. In fact, I wondered how you really compare and contrast, so I figured, what the heck? No question that my gene pigment devolved in order for me to make enough vitamin D. So how do you make your vitamin D? When you're exposed to sunlight, it's the precursor of cholesterol in your skin, absorbs that ultraviolet light, making vitamin D. So you may wonder, if you're using a statin, are you going to inhibit cholesterol biosynthesis and prevent vitamin D production in the skin? The answer is no, because statins don't get into your skin. Now, she's a lot of bad habits and a lot of worries, but one thing you'll never have to worry about in the summertime if you're going out on vacation is you will never make too much vitamin D, because sunlight cleverly destroys any excess, so you can never become toxic from sun exposure. Now, he's the poster child for sun exposure, and it's true because I'm asked the question all the time, is it any better to be exposed to sunlight, and is that vitamin D better than the vitamin D in a supplement? When you make it in your skin, it lasts 2 to 3 times longer in your body than when taking it as a supplement, which is one of the reasons we often recommend taking a supplement every day. Now, for humans, the story begins with the Industrial Revolution, and the children in these alleyways of Glasgow, Scotland, developed classic rickets, which of course is growth retardation and these skeletal abnormalities. It was 2 physicians in New York City that showed that just exposure to sun could cure rickets. This led to a novel concept, believe it or not. In 1931, the US government sent this brochure out telling parents to put your children outside to get some sensible sun to prevent them from getting rickets. But in this day and age, people worry about skin cancer. And indeed, for 40 years, we've been taught by the dermatology community you should never be exposed to one direct ray of sunlight because of its damage to your skin. In fact, in the United States, if you ever put a child without a sunscreen outside, you could wind up on America's Most Wanted for child abuse. Indeed, this is the problem. There's essentially no vitamin D in your diet. Cows don't put it in your milk. Right? It was Harry Steenbach in Wisconsin who realized if you're going to irradiate people and animals, why not irradiate the food? That led to the magic vitamin D process and the fortification of vitamin D in milk. Now, you would say, of course, in Europe, you don't fortify your food with vitamin D. But believe it or not, you did. Back in the 1930s and 40s, most things in Europe were actually being fortified with vitamin D. Now, do you know why vitamin D is so regulated and why you've been taught that it's so toxic? It turns out here in England, custard was routinely fortified with vitamin D. And even in Chicago, hot dogs were fortified with vitamin D. But in the 1950s, there was an outbreak of a few infants that came in that had high blood calcium, and they had mental retardation, altered faces, and supravalvular aortic stenosis. And the experts had not a clue what this was due to. So they read the literature, and they found that if you give pregnant rats high doses of vitamin D, these rats wound up with these birth defects and also heart problems, and they had high blood calcium. So the experts concluded, without any evidence, that it was likely the overfortification of milk with vitamin D. Because of this, the experts concluded this, Europe banned all vitamin D fortification. And that ban remains on the books today. But we believe that it's likely that these children had a rare genetic disorder called Williams syndrome, elfin facies, they have heart problems, mental retardation, and they have a hypersensitivity to vitamin D. And so it's still banned in Europe and throughout most of the world. So vitamin D is essential for bone health. So I thought I'd bring you a couple of cases that you may not have typically see here in Austria. 7-month-old female, muscle weakness, seizures, and a calcium half normal. And it turns out it's the first lowland gorilla born in captivity at our zoo in Boston and about to die. Seen by the pediatrician, given 400 units of vitamin D. Didn't do any good. Baby's complaining to mom, and dad's upset because he knows his daughter's in deep trouble. Have you ever wondered what he was trying to say? That's what he was trying to say. And so, indeed, they called me, and I got to see the infant. Infant has classic widened epiphyseal plates, classic for vitamin D deficiency. So what do? I treat aggressively, 5,000 units of vitamin D a day. And in fact, I was a guest of honor for her first birthday. Message, Mommy, will my growth be stunted? If you went to the zoo to see her, just because of her first few months of life of vitamin D deficiency and in utero vitamin D deficiency, her growth was permanently stunted. We estimate globally, in Europe as well as in the United States, more than 50% of infants that are born today are born in a deficient or insufficient state. In 1889 in Boston, rickets was common. Is it a problem today? You better believe it. Why? Because there's this concept out there that human breast milk will provide the infant with all of his or her nutritional requirement. It will not. There's essentially no vitamin D in human breast milk, about 25 international units in a liter of human breast milk. So if you give your infant as sole source of nutrition, human breast milk, that infant will be vitamin D deficient for that period of time. Now, we also asked the question at our hospital, women pregnant were getting a prenatal vitamin. And so when I told the neonatologist that I think that your women are vitamin D deficient, they thought that I was crazy because they're perfectly happy taking their prenatal vitamin. So we did a study at our hospital, 40 mother-infant pairs, and we very carefully analyzed their intake of multivitamin and milk consumption. They were taking 600 units of vitamin D a day. This is the amount of vitamin D recommended by the Institute of Medicine for all women of this age group, including pregnant women. And we reported 76% of moms, 81% of newborns were vitamin D deficient. Why should you care? Because we went on to show that preeclampsia is associated with vitamin D deficiency. Now, who are they? These are 3 children born by cesarean section, 1889 in Glasgow, Scotland. Why? Because vitamin D is critically important for muscle function, which of course is important for the birthing action. And so we did a study in over 200 women at our hospital and asked the question, association with vitamin D deficiency and need for primary cesarean section. And the probability decreased by 400% just by being vitamin D sufficient at the time that they gave birth. Now, I'm not sure what Christina's here thinking about, but we're telling all pregnant women they should be on 2,000 units of vitamin D a day, along with their prenatal vitamin, and to get some sensible sun exposure. How much does a lactating woman need to put enough vitamin D in her milk to satisfy her requirement? Bruce Hollis and Carol Wagner showed 4,000 to 6,000 units a day. Indeed, pediatricians have been paranoid about vitamin D toxicity, but even the American Academy of Pediatrics recommends that all infants from the time they're born need 400 international units of vitamin D a day, especially breastfed infants. Indeed, in Canada, they recommend up to 800 units a day. For pregnant and lactating women, 2,000 units a day. 1-year-old female, muscle weakness, bony deformities, and failure to thrive. This is a major problem in the United States, and it may be a problem here in Europe as well. It's known as the geographic syndrome. Estimated 750,000 young at risk, all because of Jurassic Park and Steven Spielberg. Why? Because children who saw Jurassic Park wanted to have a pet dinosaur. And what better animal to have than an iguana? Well, iguanas are like human beings. They're vertebrates. They need a source of calcium and vitamin D. But they love lettuce. And so they're often fed a steady diet of lettuce. And they wind up with significant osteoporosis and osteomalacia. And the 750,000 in poor United States fractured their rib cages, their long bones, they fall off their perches, and they die. My 9-year-old daughter went to see Jurassic Park with me, and she wanted a pet iguana. I couldn't have a pet iguana die of a calcium and vitamin D deficiency. So what do? You keep up with the literature. And if you keep up with the reptile literature, back in 1997, metabolic bone disease, this is what happens when you're vitamin D deficient. I always like the response from the audience. You show a patient like this, nobody cares. But you'll remember, vitamin D deficiency increases risk for vertebral fractures, as well as non-vertebral fractures. And so now, how do you treat it? Just like for our patients, how do we get them to take their calcium every day? And so I gave it some supplement, I gave it some milk, wouldn't do any of it. No. And so he's not foaming at the mouth. He's getting low-fat cream cheese in between the lettuce. So he's getting all the calcium that he needs. There's no vitamin D in low-fat cream cheese. So what to do? Well, they like to be outside because they make lots of vitamin D. So you know how industry can rise to the occasion when the opportunity is there? In the United States and here and even Europe, you can go to your local pet shop and you can buy Reptisun that mimics sunlight so that your pet reptile at home will make vitamin D in its skin. We don't do this for our nursing home residents, no, or our malabsorption patients, no. But we do this for our pet iguanas. Indeed, there he is smirking because I just spent $40 so he can make some vitamin D in his skin. So I have a happy daughter with a happy iguana. And you need calcium and vitamin D for strong bones and healthy teeth. And when you do that, both my daughter and her iguana grew very well. 25-year-old female, poor dentition, dental caries, tooth eruption. Turns out a major problem for non-human primates. But it also turns out that one of the major Centers of Disease Control prevention report, dental caries is the most common childhood disease in America, 5 times more common than asthma. And it was demonstrated that there's an inverse relationship with maternal vitamin D status and the amount of decay in infants after they are born. Also, periodontitis is a major issue, and it turns out that a study from the National Health Survey showed the higher your vitamin D status, lower is your risk for periodontal disease. Fertile couple from Indonesia, they show up in Washington, D.C., and they had non-viable offspring. This was a major PR problem about 3 decades ago. Why? Because there were no Komodo dragons in any zoo in the United States. And Sukarno from Indonesia visited Nixon and brought a mated pair of Komodo dragons. And so they mated, and they had non-viable hatchlings. I happened to be in Washington, D.C., and my friend at the National Zoo asked me to come over. And they said, Holick, you're an endocrinologist. You probably have a hormone problem. Can you help us? I said, well, they have a hormone problem, but not the kind you're thinking about. They're in a glass enclosure, and they cannot make any vitamin D when you're exposed to sunlight through glass. And I said, I'll bet you they're vitamin D deficient. Now, how do you determine that? Very carefully. And how do you treat it? Equally carefully. And we did. And we went on to show that they can't make any vitamin D. And sure enough, when we gave mom and dad vitamin D, all of the eggs hatched the next go-around. Bottom line is that, did you know, vitamin D deficiency is associated with low infertility, low birth weight, and poor birth outcomes. So I'm an unusual consultant, because I consult for many zoos in the United States, because this continues to be a health issue. This is the problem. You assume you're having a healthy diet, you're getting all the nutrients that you need. There's essentially no vitamin D in your diet. Indeed, even in the United States, where food is fortified with vitamin D, no child or adult can get enough from dietary sources. 0%. Right? Why is he carrying this mushroom? Because if you expose mushrooms to sunlight, they will make vitamin D. So sun-dried mushrooms is a good source of vitamin D. And in fact, some in Australia and in the United States are now irradiating mushrooms and providing them on the produce section in the supermarket as a source of vitamin D. But back in the 1940s, right, they used to have kids line up for cod liver oil because it tasted so good, right? We don't do this anymore. And it comes in tablet, oil, and an emulsion. And you realize by now I'm a little bit controversial on my recommendation for sensible sun exposure. And I'm constantly interviewed by the press. And I'm asked the question, do you really need sensible sun? And the dermatologist said, no, eat more fish. Well, how much fish do you have to eat? Tell you what, not a pretty sight, right? Indeed, go sail fishing with my son, the catch-release program in Guatemala, they have none. These rooster fish are gorgeous fish, they have none. It's only oily fish, salmon, mackerel, herring. How much do you have to eat? You'd have to eat it every day. There's only 500 to 1,000 units in a serving. Indeed, we went on to show that wild-caught salmon, whereas farm salmon have hardly any, wild-caught salmon have plenty of vitamin D. So if you're going to get your salmon, make sure it's wild-caught if you want your vitamin D. This is where we're getting our vitamin D from casual or not so casual exposure to sunlight. It provides us with our vitamin D requirement. Out there in the summer, feeling great, making lots of vitamin D. What about in wintertime? So I carefully reviewed the meteorologic literature, and this gives a good insight to the problem. The ozone layer shields the rest of the solar system from Earth's harmful effects. In the summer, the sun is directly above you, and you're making vitamin D. What about in the wintertime? Now the sun is coming in at a more oblique angle. Can you make any at all? So I got one of my students to go up on the roof to measure how much vitamin D you're making, and we showed in Boston, in the spring, summer, and fall, you make vitamin D. In wintertime, you cannot make any at all. And if you think about it, right, in the wintertime, you can't make any at all. Guaranteed, right? Now my daughter, who is up in Vermont at school, went down to Miami, found that we could make it year-round. So guess at what latitude you basically cannot make any vitamin D in your skin. If you live above Atlanta, Georgia. So guess what? Living here, you basically cannot make any vitamin D in your skin from about mid-October until the end of March. You've been taught this. Go out in the early morning, late afternoon, because the sun is shining late at night here at this latitude, and make your vitamin D less damaging to your skin. It's actually the worst time to be out, and it's probably damaging your skin more. But the bottom line is you make no vitamin D. It's great for romance, but you make no vitamin D. It's from 10 a.m. until 3 p.m. Even at the equator is when you make your vitamin D. This is what we've been taught about the sun. No question, excessive exposure will damage the skin and increased risk of non-melanoma skin cancer. So there's an evolution in thinking about beachwear. 50s was the two-piece, 70s was the one-piece, and new millennium is lots of sunscreen and a lot of clothing. So what if you put a sunscreen on? How much does it reduce vitamin D production? And so we did a study, and we showed that whole body exposure, SPF of 30, reduces your ability by 98%, right? 90 to 95% of your vitamin D is coming from sensible sun exposure. So how much? Well, you never want to burn. Can't look like this. And coming from New England, of course, you can't look like that. But early in evolution, we knew exactly how long to stay outside and go back into the shade, but we lost that ability about 10,000 years ago. So I reviewed the literature, and here we go. How do you know when you make enough vitamin D? These little poppies just pop out of your belly button. That doesn't happen anymore. So we did a study, and we took some students, put them in our tanning bed, and gave them an oral dose of vitamin D to see what the equivalence was. So 1 minimal erythemal dose of light pinctus to your skin 24 hours later is equivalent to ingesting about 20,000 units of vitamin D. So your skin has a huge capacity to make vitamin D. Indeed, if you get the RDA of 1,500 to 2,000 units a day, if you expose 15 to 20% of your body's surface 2 to 3 times a week, it will satisfy that requirement. Now, why is she screaming? We finally figured it out. Because if you go on the internet, they say you should never bathe once you've been exposed to sunlight because you're going to wash off that precious vitamin D. No, because you actually make vitamin D in your living skin cells. You cannot wash it off. So I do encourage you to bathe after you've been sweating outside in the sun. Does sunlight provide you with your requirement? No matter what your ethnicity, here even in Denmark, peak blood levels are at the end of the summer. The nadir is always at the end of the winter. Now what about Burns here? He heard that aging reduces your ability. And in fact, The Simpsons kept up with the literature we published back in 1989, 75% reduction in a 70-year-old compared to a 20-year-old. So the question is, can you make any at all? And so, of course, we did a study. We took up some elders, wheeled them out on a veranda, and exposed them to sunlight, and showed that 15 to 30 minutes significantly raised their blood levels. So how much sun exposure? Recommend typically, if I know I'm going to get a mild sunburn after 30 minutes, 5 to 15 minutes of sunlight, arms, legs, abdomen, and back. Always protect your face. It's the most sun exposed and most sun damaged. Followed by good sun protection, just like what she's doing here. Yeah, we finally figured out what he was trying to say, right? In fact, even Barney was amazed to hear obesity causes vitamin D deficiency, right? The higher your BMI, lower is your 25-hydroxy vitamin D level. In fact, we went on to show that if you take a normal weight and an obese individual and expose them to ultraviolet radiation or give them an oral dose of vitamin D, they only raise their blood level by about 45%. So is it really there? Evidence-based medicine. So I went to our bariatric surgeon and I said, I need a gram of your fat, Mrs. Jones. No problem, doc. And sure enough, they have plenty of vitamin D. And so we now know that obese people need to take 2 to 3 times more vitamin D than a normal weight person to satisfy that requirement. Now, Pele here with his girlfriend, he has to be outside 4 to 10 times longer because he has a natural sunscreen. So how do you know your vitamin D status? That's been a major issue for docs. And so what you want to measure, of course, is 25-hydroxy vitamin D. Never order the active form of vitamin D. Indeed, it's the barometer for vitamin D status. And so the normal range, typically from a lab, is 50 nanomoles per liter up to 250 nanomoles per liter. So often, though, you have an H coming back, especially if you have somebody that went on a sunny vacation in the summertime. The question is, are they intoxicated? And so if you have a level of 120 nanograms per ml or a little over 270 nanomoles per liter, right, are they vitamin D intoxicated? I don't think so. No. You don't even have to begin to worry about intoxication until you're over 375 nanomoles per liter. But what about that lower range? How do you know if you're sufficient? And so we and others have done studies. This is one study that we did throughout the entire United States in postmenopausal women. And we looked at their PTH levels when they began to plateau. And they begin to plateau at around 75 nanomoles per liter. And we also looked at secondary hyperparathyroidism, and they had a 3 times higher risk of having an elevated PTH compared to being above 75 nanomoles per liter. And so, no question, what is the role of sunlight for your PTH? So we did a study, a retrospective study between 25-hydroxy vitamin D as well as PTH, 3.3 million samples. And we looked at the diurnal variation, and we showed, on average in the United States, in wintertime, it's about 47.5 nanomoles per liter. And that in the summertime, it goes up to about 65 nanomoles per liter. And that if you live further south, that peak is still the same, but the nadir is a little bit better. And so the real question, however, is, what about your PTHs? Because you often order a parathyroid hormone if you're measuring 25-hydroxy-D. Do they relate? And it turns out, looking at this data, we could finally make some sense out of this, that there's a 4-week lag time before the PTH levels peak at the time when your 25-hydroxy vitamin D levels are at their lowest level. But the real question to be asking, and we don't have an answer for it, is should PTH levels be fluctuating throughout the year? Should our blood levels of 25-hydroxy-D be fluctuating throughout the year, or should they remain stable throughout the year? Now, the Institute of Medicine also depended on this study. It turns out that this is a study of 675 German healthy adults, ages 20 to 90 years of age, that died in some type of accident. And they wound up getting their blood as well as their bones. And they showed, typically, many had normal bone mass, but some had very low bone mass, osteoporosis. But some had normal bone mass, but a lot of this pink stuff. This pink stuff is known as osteoid. It's a classic sign for vitamin D deficiency bone disease. And so the study authors suggested to guarantee sufficiency, you want to have a blood level of at least 75 nanomoles per liter. So these otherwise healthy German adults didn't realize it, but they had underlying metabolic bone disease due to vitamin D deficiency, right? And so the authors suggested you needed to be at least 75 nanomoles per liter with no evidence of osteomalacia. And if you look at the data very carefully, you could see 24% of healthy adults between 52 nanomoles per liter had evidence of vitamin D deficiency, bone disease, and 0 if you were above 75 nanomoles per liter. And so the Endocrine Practice Guidelines Committee recommends that you should be 40 to 150 nanomoles per liter is an ideal range to have your patient in. Up to 250 nanomoles per liter is perfectly fine. But is vitamin D deficiency a health issue? You would think with all of modern medicine these days, it can't possibly be a problem. Even in the United States, with food being fortified with vitamin D, the CDC concluded 33% of all children and adults are at risk. Here in pediatrics, if you use 75 nanomoles per liter as the cutoff, children 6 to 11 years of age, 70% were vitamin D deficient. So if you look globally, and here in Europe, 57 to 64% on average, vitamin D deficient. Vitamin D deficiency regarding bone disease, right, will cause osteomalacia and precipitate and exacerbate osteoporosis. Precipitating osteoporosis is a silent disease. And so as a result, you don't know it until these patients fracture. But osteomalacia is not so silent, right? Typically, in the wintertime, this husband is saying, curiously, your aches and pains in your bones and muscles always occur in the winter. I wonder why. Turns out, generalized bone pain, isolated bone pain, muscle aches and pains. The nouveau diagnosis, of course, is fibromyalgia. Most of these patients that I see in my clinic are vitamin D deficient. And most of them that I treat with vitamin D have dramatic improvement in their symptoms. Here, Mayo Clinic proceedings in Minnesota, Plotnikoff reported of 150 children and adults presenting with aches and pains in their bones and muscles, 93% were vitamin D deficient. Right? Here's classic. 23-year-old female shows up with muscle fatigue, non-radicular lumbar pain, given this wonderful diagnosis of dysthymia, being depressed, put in an NSAID, sent home. Asian female, same thing. This black male actually lucked out. He was put on a narcotic, sent home. They were all vitamin D deficient. Right? Now, I'm not sure that he had to really use steroids, right? Because we've always known vitamin D is critically important for muscle function. Right? We have a vitamin D receptor in our skeletal muscle. And we now understand about Superman. Couldn't make enough on Krypton. And it turns out, I went on the internet to look up Stefan when he was a child, and he remembers even back then vitamin D was good for muscle strength. Now, even in Europe, they showed vitamin D status predicts physical performance, again, at around 75 to 80 nanomoles per liter, maximum physical performance. And we did a study and showed in nursing home residents, 72% less falls for patients that were on 800 units of vitamin D a day for 5 months. 200 and 400 was of no benefit at all. But there's also been a study recently in JAMA saying monthly high-dose vitamin D treatment for the prevention and function and decline suggested that although higher monthly doses were effective in raising the blood level, there was no benefit in lower extremity function and that there was increased risk of falls. But you read the paper carefully. What they did to recruit these people is that they sent out a newspaper advertisement and they asked the question for those 70 years and older, have you fallen in the past year? And only if you say yes, you're in the study. And so, of course, they call up and they say, I fell. And now they're put in, followed for 12 months. But not all of them fall again. And so how are you able to know what the benefit of vitamin D was? Because you had a 100% fall rate, and now you have less fall rate, even though they're on a higher dose of vitamin D that may have had a difference in the group that had lower vitamin D intake. So I think that, from my perspective, that this publication is somewhat suspect because of the way they recruited the subjects in the beginning. So I'm not sure what he's thinking about, but I tell you what, he's constantly complaining to his dog about aches and pains in the bones and muscles. Dog told him, stupid, you're vitamin D deficient. Right? No question. You want to be at least 75 nanomoles per liter, good for muscle strength, bone mineral density, reduce risk of falls, improve your bone density, less likely to fracture. Now, how do you treat vitamin D deficiency? Right? A major issue. So you can take a multivitamin, but there usually is only about 400 units. So how many are you going to take? Well, you can't take too many because you're going to choke on them. And also, you get too much vitamin A. You can only take one. And so when your tank is on empty, you get a liter of gas. No, you fill it up, right? And so what we typically do in the United States, because we have a 50,000 unit dose, is I give 50,000 units once a week for 8 weeks. Fill up the tank. It's equivalent to about 6,500 units of vitamin D a day. But now the docs are doing this. And then they put them on 1,000 units of vitamin D, and they come back 6 months later deficient again. And they wonder why. Well, it turns out that you have to put them on a higher dose, right? And so I put them on 50,000 units every 2 weeks forever. That's equivalent to 3,000 units of vitamin D a day. Now, you may argue, right, it's fat soluble, going to build up in your body fat, may work for a couple of months or a year, but what about long term? Are you going to worry about toxicity? So we did the study, because Einstein was equally concerned about this issue, right? And we showed and published in Archives of Internal Medicine in 2009, our patients on an equivalent of 3,000 units a day for 6 years, levels on average, 100 nanomoles per liter, and there was no toxicity. Now, not sure what he's thinking about. People worry about deintoxication. So you have to have an elevated calcium and a markedly elevated 25-hydroxy-D. We went on to show with Bob Heaney, up to 10,000 units a day to healthy adults is perfectly safe. Right? A study done in Calgary at the same kind of latitude that you live at, 15,000, 20,000 units a day that some of these Calgarians were ingesting, their levels were about 150 nanomoles per liter. They did not develop kidney stones. They did not develop hypercalcemia. There was no evidence of intoxication. And in fact, we know that you have to be at least 375 nanomoles per liter to begin to worry about this issue. But what about infants and children? Because they're more sensitive. So Bruce Holick and Carol Wagner did a study looking at infants and toddlers. And also, Catherine Gordon showed 2,000 units a day, 50,000 units a week for 6 weeks was perfectly safe. Right? Pregnant women, Bruce Holick and Carol Wagner showed that if you give pregnant women 4,000 units a day, you could raise your blood level to 125 nanomoles per liter. There was no toxicity. Serum calcium was perfectly normal. The most sensitive indicator, of course, is if there's an increase in urinary calcium excretion. There was no change. But can you become intoxicated? You better believe it. I got this phone call one morning from a lawyer in Florida, and he calls me up and he says, "Are you Dr. Holick?" I said, "No." Why would I want to talk to a lawyer at 7 o'clock in the morning? And he said, "I know you're Holick because you're the only one there early in the morning." I said, "Okay." He said, "I'm going to sue you because back in the 1990s, I was already encouraging people to be on 2,000 units of vitamin D a day. And in the United States, back then, nobody cared about vitamin D, so you could not find vitamin D anywhere in the pharmacy." And so he went on the internet, and he bought this product that had 1,000 units in a teaspoon. And he took 2 teaspoons a day for a year. And he was severely intoxicated. I told him, "Before you sue me, send it up and I'll do an analysis for you." The company forgot to dilute it. He was taking 1 million units a day. This will cause deintoxication. In fact, we published him in the New England Journal of Medicine. He had a calcium of 15, 25-hydroxy vitamin D of over 1,000 nanomoles per liter. Changing incidence of serum 25-hydroxy-D values above 50 nanograms per ml. Very nice study published recently in the Mayo Clinic proceedings. 1,700 have a blood level above 125 nanomoles per liter. A very small percentage have above 250 nanomoles per liter. None of them had any evidence of toxicity. But you can become toxic because those that had blood levels that were way above 900 nanomoles per liter had a calcium of 17 milligram percent. So vitamin D is very safe. And you don't have to worry about taking a supplement and going out into the sun and even eating salmon every day. You will not become vitamin D toxic. It is difficult to become vitamin D toxic. Now, why should you care about this whole story? Because as you've heard already from the clinical cases, that vitamin D has a lot of non-skeletal effects. And indeed, we also know, of course, that vitamin D is a hormone because it's made in your skin, goes to your liver, and then to your kidneys to get activated. But curiously, not only are your calcium-regulating tissues containing a vitamin D receptor, but every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having an effect? It turns out, other functions. First study was done in 1979 by Dr. Tetsuo Suda. He showed that leukemic cells that had a vitamin D receptor, if you incubated them with the active form of vitamin D, they became normal. So this introduced the concept that maybe improving your vitamin D status could be of benefit in reducing risk for cancers. Indeed, what about the cancer connection? It turns out a lot of evidence linking sunlight deficiency and vitamin D deficiency with increased risk. The first study that was done, this association study, was in 1915, and they showed in San Diego area those people that worked indoors had an 8 times higher risk of developing and dying of cancer than people that worked outside. Indeed, sunbathing could cut your risk of cancer. 1941, it was reported by Apperly. If you lived in the Northeast, you're more likely to die of cancer than if you live down south in the United States. This led then the Garland brothers to realize that if you just give a person 1,000 units of vitamin D a day, potentially could reduce risk of colorectal cancer by about 50%. Out of the Nurses' Health Study out of Harvard showed nurses that had the highest blood level, on average of about 125 nanomoles per liter, 50% lower risk of developing breast cancer. Also, Bob Heady's group showed women taking 1,100 units of vitamin D a day reduced risk of all cancers in 4 years by about 60%. Possible connection. Well, you may argue, makes sense, right? Because you're exposed to sunlight, you're taking vitamin D, you get your kidneys to make more of this active form, it has anti-cancer properties, so reduces risk of cancer. Well, it doesn't work that way. And the reason is that the body isn't stupid. Because active vitamin D, yes, will inhibit cancer cell growth, but you can't get your kidneys to make more active vitamin D because it'll stimulate intestinal calcium absorption, remove calcium from your bones, and you'll become hypercalcemic. And so no matter how much sun exposure you have, no matter how much vitamin D you ingest, you will not raise your blood levels of 125-dihydroxy vitamin D, the active form. That was a real conundrum. So in the mid-1990s, working with Gary Schwartz, we showed that prostate cells actually could activate vitamin D. And we went on to show, and many others have reported the same, is that many cells in your body have the capacity to activate vitamin D, regulate a whole host of genes, and then induces what's called the 24-hydroxylase to destroy it. So that as soon as it enters a cell, it begins the process of it destroying itself, but in the meantime has a lot of beneficial health effects. It's estimated up to 2,000 genes are directly or indirectly regulated by vitamin D. What about your immune system? We've always known activated macrophages activate vitamin D. Have you ever wondered why? We now know why. 1849, cod liver oil and tuberculosis. Vitamin D protects against TB. It turns out in 2006, Maudlin and Adams reported that if you infect a macrophage with a TB, for example, you turn on toll-like receptors, and what do? They tell the macrophage to activate vitamin D. So the cell now has 125-dihydroxy vitamin D within it. Why? Because it then tells the cell to increase expression of cathelicidin. It's a defensin protein that specifically kills infective agents. We now understand why probably people living at higher altitude, it was known back in the early 1900s, if you lived in the higher altitudes, you're less likely to get TB, and patients with TB were often put into higher altitudes. Why? Because at a higher altitude, less ozone, you can make vitamin D year-round. And so with the flu season just leaving us, it's always curious to know that there's a so-called seasonal stimulus. That is, that the peak flu season is always at the end of the winter. And that's at the time when the nadir for 25-hydroxyvitamin D occurs at about 30 nanomoles per liter. Studies have shown here in Yale University, a group of healthy adults, if you maintain a level of about 100 nanomoles per liter, reduce risk of upper respiratory tract infections twofold. A study done in Japan giving school children during the winter 1,200 units of vitamin D a day, looked at the incidence of influenza A infection, reduced it by 42%. Vitamin D deficiency and type 1 diabetes. Curiously, the lower the latitude that you live, are born at, and live at, lower is your risk for developing type 1 diabetes. Living far north, Scandinavian countries, for example, 10 to 15-fold increased risk. Opponent had shown many years ago, back in 2001, that Finnish children back in the 1960s were receiving 2,000 units of vitamin D a day because they appreciated back then living so far north that they couldn't make very much vitamin D. And she followed them for 31 years and asked the question, what was the incidence of type 1 diabetes in these infants? Reduced that risk by 88%. Look at this. Then the Finns became concerned about deintoxication. So they decreased it from 4,500 to 2,000, and then to 1,000, and then to 400 units a day. Look at the incidence of type 1 diabetes on the rise in Finland. Other evidence. Your beta islet cells have a vitamin D receptor. And guess what? The active form of vitamin D will stimulate insulin production. So it wasn't a surprise when it was reported by Pittas back in JCNM in 2007. Higher your calcium intake, higher your vitamin D intake, 33% relative risk reduction in developing type 2 diabetes. That magical latitude of about 35 degrees, if you live above this latitude for the first 10 years of your life, both in Europe and the United States, you have a 100% increased risk of developing multiple sclerosis for the rest of your life. A study done at the Nurses' Health Study out of Harvard showed nurses that had the highest intake of vitamin D reduced their risk of both rheumatoid arthritis and multiple sclerosis by about 40%. The Framingham Heart Study showed, looking at vitamin D status and relating it to osteoarthritis, that there was an association. Also, it's well documented from the National Health Survey, peripheral vascular disease and vitamin D status, 80% reduced risk above that magical number of about 75 nanomoles per liter. Also, Zitterman published very nicely, low vitamin D status contributing factor to the pathogenesis of congestive heart failure, especially in younger adults. So what about the mechanism? It turns out that there's about 200 genes that may be directly or indirectly regulated by vitamin D, having an effect on atherosclerotic production, on regulating blood pressure, as well as on cardiomyocyte function. In circulation, from the Framingham Heart Study, they showed first myocardial infarction, 50% increased risk associated with vitamin D deficiency, 25-hydroxy-D of less than 37.5 nanomoles per liter. So, but you've heard this. Calcium supplements increases cardiovascular calcification. So, of course, all of my patients that I have on calcium and vitamin D immediately stop all of supplementation because they heard it on the news, so it must be correct. Well, it turns out, read the literature carefully, because a lot of these so-called new studies are really meta-analyses. It's a rehashing of the old data, some of which, in my opinion, has not been interpreted properly. And in fact, I think a very good study that came out of the Nurses' Health Study of almost 75,000 women. there was a 29% reduction in cardiovascular disease for those who took their calcium. Here's another study that comes out of China. Calcium intake and risk of stroke, an update. Of the 10 studies, over 300,000 participants, dairy calcium intake inversely associated with stroke incidence. Effect of vitamin D supplementation on blood pressure. This study suggested that there was no significant benefit. But we did a study in healthy teenagers in Georgia, and we asked a simple question, because they were all vitamin D deficient. Their average level was about 25 nanomoles per liter. And we gave them 2,000 units of vitamin D a day. And this is based on a study coming out of the National Health Survey suggesting in the United States, 50 million teens are deficient or insufficient. They had a 2.4-fold higher risk of having high blood pressure, 2.5-fold increased risk of elevated blood sugar, and a 4-fold increased risk of pre-type 2 diabetes. And so in this 16-week study, we took 49 African-American teens, 16 years of age. They got either 400 or 2,000 units a day for 4 months. 20-hydroxy-D went from 27 up to 60 nanomoles per liter on the group getting 400 units a day. But the group that received 2,000 units a day went up to 85 nanomoles per liter on average. And there was a significant decrease in arterial wall stiffness based on ultrasonography, which of course is the prelude for hypertension in these young black children. Now, if that doesn't get your attention, this might. All studies have suggested you improve your vitamin D status, you are less likely to die. Indeed, very nicely done in Germany, they showed that a blood level above 75 nanomoles per liter all-cause mortality reduced by 25%. In fact, the Garland brothers also reported 100 to 125 nanomoles per liter, a sharp drop in mortality if you're below about 50 nanomoles per liter and it plateaus out, and greater than 250 nanomoles per liter continues to maintain this benefit. But the Institute of Medicine came out with something different that you may have heard about, the so-called J-curve or U-curve, i.e., that they all agree that if you're vitamin D deficient, you are at higher risk of dying, most likely of cardiovascular disease. However, there's this magical level here of about 50 to 72.5 nanomoles per liter, where now all of a sudden there's a slight uptick, suggesting that you have to get your level very carefully controlled, otherwise you're going to lose that benefit and possibly increase risk for mortality. Above 75 nanomoles per liter. And this is one of the studies that they used. And it turns out, curiously, that this study actually said that there's a decrease in mortality up to 122.5 nanomoles per liter. So they didn't quite get that study correct. But more importantly, how do you achieve 125 nanomole per liter or greater? That means that likely you're treating this person for vitamin D deficiency. And if so, they're going to still have that risk for increased risk for mortality. But how are you going to figure that out? Well, it turns out, go back to that study that we did with the 3.3 million samples, it turns out that in the United States, we treat pharmaceutically with vitamin D2. And so we measure with liquid chromatography, tandem mass spectroscopy, 25-hydroxy-D3 and 25-hydroxy-D2. So if you see 25-hydroxy vitamin D2 in the blood, it means that those patients are being treated for vitamin D deficiency. And sure enough, we showed that those 57% had a 20-hydroxy vitamin D2 level, and thus they're being treated for vitamin D deficiency. So when you read these studies, and there's a lot of controversy, you really need to penetrate into that study and to be asking pertinent questions rather than just accepting the data on face value. Is there any other evidence that you can improve immune health? So we did a study in our students at Boston Medical Center, and we decided that ultimately, what in your body knows your vitamin D status? It's your genes. And so we did a study. And what we did was we gave 8 healthy adults for 12 weeks, either 400 or 2,000 units of vitamin D a day. And we did their white blood cells, and we measured by chip analysis 22,500 genes. And so all of these blue lines are all genes that were turned off. All of these orange and white lines are all genes turned on. And just giving 2,000 units of vitamin D a day for just a couple of months, we reversed all those genes in their activity. And what were they doing? Well, we found out that, in fact, they were controlling up to 80 different metabolic processes, improving DNA repair, apoptosis, oxidative stress, metabolic processes, and anti-inflammatory activity. So this data clearly demonstrates that we should not be giving people 400, 600 units of vitamin D a day. They should be taking minimum 1,500 to 2,000 units a day as recommended by the endocrine practice guidelines. So feed your genes right with vitamin D. Now, I'm not sure what he's thinking about, but I tell you what, adequate vitamin D is critically important from birth until death. Indeed, vitamin D deficiency is a disease of neglect, right? There's a mountain of evidence linking it to these chronic illnesses, which we've talked about. So don't think about a normal level, but you want to think about a healthy level. And what we like you to do is just like this study here. This is telling us evolutionarily where we should all be. These are Maasai warriors outside every day with dark skin pigmentation, exposed to the sun on a daily basis. Guess what? Their 25-hydroxy vitamin D level is about 100 to 125 nanomoles per liter. That's where we should all be. And they have good muscle strength, no question about that. And so the goal, minimum 75 nanomoles per liter. And if you think about disease burden and vitamin D deficiency, low birth weight, stunted growth, increased risk for type 2 diabetes, hypertension, fracture, cancer, infectious diseases, and autoimmune diseases. So how much vitamin D do you need? So for every 100 units you ingest, if you're at 50 nanomoles per liter, you will only raise your blood level by about 2 to 2.5 nanomoles per liter. And so if you're in this range of 45 to 62.5, and I guarantee that you are if you're not on adequate vitamin D supplementation, we showed many years ago healthy adults who took 1,000 units of vitamin D a day in the wintertime. Essentially no one even reaches 75 nanomoles per liter. So I recommend for adults, make it simple. 2,000 units a day. Obese, 6,000 units a day. Children, I give them 1,000 units a day. And there is no toxicity. Conquer D deficiency, best source. Back in the 30s, like I said, even in Europe, they used to fortify bread with vitamin D. In fact, they cleverly marketed it because they said if you didn't want your kids naked outside every day, eat vitamin D fortified bond bread, right? I know young adults wouldn't be D deficient today if they were still doing this. And I think they did this in Germany and Austria as well. Because back in the 1930s, they used to fortify beer with vitamin D. So if you wanted to keep sunny energy all winter long, you would drink vitamin D fortified beer. FDA did not take kindly to having nutritional benefit for drinking beer, so they forbid it in 1937. Look, Johnny, a spot of sunshine playing it and get your vitamin D. 1953. We've always appreciated the beneficial effect of the sun. So you realize by now I'm a proponent of sensible sun exposure. And so how do I get the message out to the public? So naively, in 2004, I wrote my first book, The UV Advantage. And in there, first page, I do not advocate tanning, right? And those that do need to be careful because you increase risk when you have a sunburn of non-melanoma skin cancer. Easy to detect, easy to treat. But we worry about melanoma. It's the deadly cancer. But I pointed out in the book, did you know, most melanomas occur on the least sun-exposed areas. And occupational sun exposure decreases that risk. And there are the data. Contrast, lifetime sun exposure appears to be associated with a lower risk of malignant melanoma. Journal of Investigative Dermatology, 2003. Ancestors' view of the sun is certainly a lot different than the dermatologist's view. No question about it. Indeed, have you ever been with a dermatologist advising you about sun protection? Always wear sun protection. Have you ever been on rounds with an unenlightened dermatologist? I like the kinder, gentler view in life, and I think Schultz epitomizes this, right? In his penis character, Linus getting no from his mom. Are you sitting in the sun? I hope so. A little sun is good, as long as we don't overdo it. Perhaps 10 minutes a day, this time of the year is about right. He was right on target. That's what we need, is moderation in all that we do. Indeed, this is what's happened to our sun. It's been demonized for more than 40 years, unchallenged. The slip, slop, slop message in Australia, 40% of Australians are now vitamin D deficient. Indeed, have you ever wondered about this?
Nothing can stop that now.
You know what he couldn't stop?
Look, you were right. You were right about me.
You know what he was right about? Right. Vitamin D deficiency is associated with dementia, right? Indeed, vitamin D deficiency has been associated with schizophrenia, depression, and dementia. Indeed, Alzheimer's disease has also been associated, increased risk for those that are vitamin D deficient. We know that the receptor exists in the brain, you can activate vitamin D in the brain, and that there's a whole host of biochemical and neurotransmission type of activities that are occurring in the brain as a result of improvement in your vitamin D status, including anti-inflammatory activity that removes a lot of the protein that is found in Alzheimer's patients. And so the brain has a vitamin D receptor, and it responds to vitamin D by increasing serotonin. So we think that's one of the reasons why people feel better in the wintertime when they are taking their vitamin D, and in the summertime when they are exposed to sunlight. Vitamin D and risk of cognitive decline. Blood levels on average, 25 nanomoles per liter or less. Significant relative risk, 31% in neurocognitive decline for our elders in nursing homes. So who is this? That turns out to be a dermatologist in Australia. And sure enough, he's wearing a sun protection. And so they decided to measure his vitamin D levels. And in fact, they published this and showed that 87% of Australian dermatologists were vitamin D deficient at the end of the summer. This is what you've been taught. You can get vitamin D from your diet. I hopefully have convinced you, you cannot get it from your diet. In fact, what do? Well, just like the best source is sunlight, right? But time of day, season of the year, latitude. How do you know how long to stay outside? There's only one thing to do. Develop an app, which is what we've done. And so you can go to dminder.info. It's for free on your Android or iPhone. And it will tell you anywhere on the globe, including here in Vienna, in the morning what time you begin making vitamin D. You put in your skin type, and it'll tell you when to get out of the sun so you do not get a sunburn. I, like all my family members, sun protection on face, but not on my arms and legs. And I, like all my family members, take about 4,000 units of vitamin D a day. Blood level, about 137.5 nanomoles per liter. Vitamin D deficiency is probably the most common medical condition worldwide. And if any one of these chronic illnesses that I've discussed with you today turn out to be associated with vitamin D deficiency, there is no downside to increasing your vitamin D intake. Right? You don't need to be a genius to know this. We need sensible sun and vitamin D supplement recommendations. This is not a hypothesis. Indeed, like I said, should you be screening everybody since vitamin D is so important for everybody's health? And the answer is no. But if you're obese, if you're on glucocorticoids, if you're pregnant, these are circumstances where it's reasonable to be following blood levels of 25-hydroxyvitamin D. But everyone else should improve their vitamin D status by taking vitamin D supplementation and getting some additional vitamin D from dietary sources. I've written a new book called The Vitamin D Solution. And in 2011, like I said, Endocrine Practice Guidelines Committee, right, This is a society that recommends to doctors worldwide how much vitamin D your patient should be taking. Infants, 400 to 1,000 units a day. Now, why did we give this range? Because how do you know you gave exactly 400 units, especially if you have a vitamin D drop, right? And you put one extra drop, and you think, oh my God, the poor infant's going to be intoxicated. So a range is perfectly safe. Like I said, up to 2,000 units a day for infants back in Finland was perfectly safe for a year. For children, I think that teenagers should be treated like adults, but for children, 600 to 1,000 units a day. And for adults, definitely, 2,000 units a day is my recommendation. Like I said, I personally take 4,000 units a day. And those that are obese, you'll find that they are going to need at least 4,000 to 6,000, up to 10,000 units a day to satisfy that requirement. And you shouldn't feel uncomfortable about prescribing that amount of vitamin D. We showed that 10,000 units a day for half a year in healthy adults did not change urinary calcium or serum calcium levels. It will not cause intoxication. Safe upper limit, easily 2,000 for infants, easily 4,000 for children, easily 10,000 for teenagers and adults. Right? Vitamin D is very important to improve your health. And I thank you for your time. Here comes the sun.